I have divided this discussion into two parts. Number one, the factors from the female's body or from the female side, and the factors from the male's body. Okay. Well, as you know very well that ovary produces the ovum, and that is in the form of secondary oocyte, and it fuses with what, the sperm, which are placed into the female reproductive tract, and they reach from just passing from this isthmus, and um, and complete their journey along this uterine tube and reach here. Okay. And the fusion takes place. Here is one factor, uh, that is what, the isthmus. The isthmus sometimes gets fibroids. Okay. And the fibrosis may block it, and the sperms, they don't have the way to pass this isthmus and reach the ovum. So this is the first factor. The second factor can be the hormonal one. This is anatomical, or this can be uh, due to any reason, but you can name it what anatomical feature. The second one is what, the ovarian fibrosis. Ovarian fibrosis. That is medically it is known as what, polycystic ovarian syndrome. What, this is known as what, PCOS. What, PCOS. Uh, about 30% of the women, they may suffer from this problem. Okay. And there is another problem which causes the prevention of pregnancy, and that is the hormonal one. If enough amount of FSH is not produced in a woman, what happens? The pregnancy does not occur, because FSH causes the maturation of primary oocyte. Okay. And that it completes its stages, and it becomes secondary oocyte. Okay. If FSH is produced, there is another hormonal reason that may cause the prevention of the pregnancy, and that is what, the stress. If a woman suffers from the stress, then what happens? The stress hormones are produced from the adrenal cortex, and they get into the bloodstream, and they reach they reach where, the hypothalamus, and from the hypothalamus, the FSH releasing hormones are produced, and those factors are inhibited, and in this way FSH is ultimately inhibited. And if FSH is inhibited, which comes from the adenohypophysis, there would be no more maturation of the ova. Okay. And if there is no more ovum, then there would be no more pregnancy. These are some factors which come from the female's body side. Okay. Now let's come to the factors which are from the male's body, or from the husband, you can say. The first important factor is azoospermia. What? Azoospermia. The normal dose of the seminal population of the sperms is 70 million. Okay. And if it is up to 50 million, it is said that the male is suffering from the oligospermia. And if it is up to 20 million, then it is said that the male is suffering from azoospermia. I mean, azoospermia is a condition when the number of the sperms is not enough to fertilize the ovum. Okay. There is another important factor which I'm going to discuss here. That is what, if you know the ABC of the structure of the sperm, you have stated in certain lecture that the sperm has a vesicle. This is known as what, acrosomal vesicle, this one. And here is the nucleus, here is the centriole, these are mitochondria, okay. And this is what, the axoneme, okay, which goes along the length of the tail of the sperm. This axoneme has, if you have the cross section of this axoneme, it is formed of what, microtubules. Two micro, this is one pair of the microtubule, these two microtubules, and there are 9 peripheral pair. This is central pair, okay. And 1 2 3 4 5 6 7 8 9, 9 pairs of microtubules are peripheral, okay. These 9 pairs of the microtubules are attached, these are connected with the central pair through the spokes, okay. Here is the spoke head, this is spoke head. These spoke heads, they attach the spoke with the central pair, okay. And yet there is an other connection between these peripheral microtubules through what, the protein called naxin. What, naxin. The important thing which I'm going to tell you people is that this dynin, this protein, okay, it has the globular head. You can see here, this is globular head. You know very well that these microtubules, they are again formed of this is microtubule, this is the microtubule, this is A, this is B, okay. This is known as complete microtubule, this is incomplete microtubule, and these are formed of what, the protofilaments. These are the protofilaments which are present in these microtubules, okay. This A microtubule has 13 protofilaments, while the B microtubule has either 10 or 11 protofilaments. It varies from species to species. Something which I wanted today to tell you people is that this dynin protein, it is absent in certain individuals, okay. If it is not present, then the propulsion of the sperm, which is carried out by this tail, that is defected, okay. And if the propulsion doesn't occur, the sperms are defected, okay. And if the sperms are defected, if they cannot move, they won't be able to reach here, okay. I mean, they have to go a long journey, just moving from the uterus up, and then passing through this isthmus, and then this part of the fallopian tube, and then they have to reach the ampulla, okay. And then they have to cross the corona radiata, and then zona pellucida, and then they have to get into the plasma membrane of secondary oocyte, and then the duty of the tail ends here, okay. So if the tail is not functioning properly, then what will happen? The sperms won't be able to fertilize the ovum, okay. This has also been seen that if the person suffers from the defected dynin protein, then those individual, they suffer from bronchitis as well, okay. I mean, the CD are present on the inner side of the bronchioles. They suffer from the bronchitis, okay. Yet there is another statistical data which suggests that these people usually have the heart on their right side, okay. Well, this syndrome is known as Carter-Jenner's syndrome or Carter-Jenner's triads. Okay, so these are two important factors which come from the male side. Okay, I think it is now clear to people regarding the factors from the male body and factors from the female body. Thank you very much.